Hello, 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 everybody. This is Irina Strunina, and this is our podcast, Diabetically Speaking with Smart Move 360. This is where we go live every Thursday at 4 p.m. Eastern Time, and I meet and talk with people who I meet along the way, people who are working in the healthcare industry. They're experts in different areas of care disciplines. And every last Thursday of the month, I meet with people who have this diagnosis, type 2 diabetes, and they live with it and they share their experiences. We call these episodes Diabetes Warriors. And on our YouTube channel, there is a specific place for those episodes as well. So, with that, today I would like to introduce you to my new friend Terri. We met with her a little while ago, but it took a little while for us to finally get together for this podcast. And Terri, please introduce yourself. Tell us about you. Explain people why I'm excited to meet with you today, what
Mhm.
you are doing, why you are passionate about what you are doing. So the stage is yours.
Thanks so much, Arena, and thanks. Um, I'm very happy to have this conversation with you all today. So, I am Terri McGuire. I am a physician assistant. I've been practicing now for 12 years, and before going to PA school, I studied public health at the University of North Carolina and also completed my undergraduate studies at Wake Forest. So, if you can't tell already, I'm originally from North Carolina. I'm incredibly passionate about the intersection between medicine and public health. And, from my practice as a physician assistant and as well as my knowledge and everything that I, started to learn, I really think it's very important to help close gaps in health literacy. A lot of times, we're talking with patients about their health and providing recommendations as healthcare providers, but just making sure that they're able to translate that information to be able to make informed healthcare decisions for themselves to hopefully help to optimize their health outcomes. And so I started Evolve Health and Wellness Community to do just that. And so I work with, patients, caregivers, healthcare providers, and healthcare organizations to improve both personal health literacy and organizational health literacy, and ultimately to advance health equity. So I've done this work in a number of capacities. I currently practice as a primary care physician assistant. So generally doing like more acute care management, in telemedicine, and I have worked in a number of other settings as well. So urgent care, I even had a stint in liver transplant surgery. I like to be involved in community events. But that's essentially the work that I do. I have worked and provided consulting services to a healthcare technology company, private practice, as well as patients and caregivers. I've spoken and I've shared my work at different conferences, and I'm just excited to be here and continue the conversation.
Absolutely. Well, thank you. And this is great. You are such a perfect person to speak about this exactly topic because, you know, so often in our Facebook group, we have this Facebook group, Diabetes 101 for Beginners, huge group now. We are
Hmm.
over 250,000 members in the group.
Wow.
And every day we have several posts where people are saying, I am newly diagnosed
Hmm.
and I have no idea what to do.
Yeah.
I've got a phone call from from my doctor's office. They told me I have this diagnosis, but I don't know what I'm supposed to be doing. That's one
Hmm.
thing. The other topic, and coming through every day again, I am newly diagnosed and I don't want my family to know about it.
Hmm.
And this is the other thing that I really uh, concerned about because I always am telling this is my personal. time to shine. I'm always saying diabetes is a team sport. You
Yes.
do need support system. You do
Mhm.
need people who can hear you, who could listen to you, who could just support you in doing something, or who could provide, not or, and who can
Mhm.
provide the medical support. And I'm not saying that this should be one person, team sport. There should
Mhm.
be multiple people who work together, know about each other. Because what you said, you also educating caregivers.
Yes.
This
Mhm.
is so important because as a caregiver myself, when my husband was diagnosed and he would go to doctor's office, he very often will not share with me everything that their
Mhm.
conversation was about. He'll
Mhm.
say, everything is good. My
Right.
blood sugar is good.
Mhm.
Doctor said, keep doing what you are doing." And I will say, what did doctor say about that? "Oh, I don't remember. What did doctor say about this? Oh, I forgot to ask about it." So there's so much information that caregivers do not receive, or they
Mhm.
receive just a fraction of the whole package, that
Mhm.
talking with people like yourself and other professionals who educate people, because you said everything today, just giving me the so many topics that we could talk about, because so often people go to doctor's office and doctor is doing the job. They are educating, but they're educating on the level that doctors are educated. They
For
give
sure.
the abbreviations, they assume that people know everything that they're supposed to know, and
Mhm.
newly diagnosed person, they are in shock. And even their hearing is limited. They don't
Mhm.
hear everything that the doctor says. They're in fog very often. And I'm not saying that health-wise, it's emotional fog. The
Mhm.
message is not coming through.
Yeah.
So, what is your experience in that?
Yeah, I think you raised a lot of great points actually. So I'll try to speak about all of those points. So when someone is newly diagnosed with diabetes, like that is a life-changing diagnosis because I'm sure there's so many things going through that person's mind. Oh, there's no cure. And then it's kind of you go to the worst case scenario of, oh, blindness. People think about, losing a limb. And so we really, as healthcare providers, really need to circle back and kind of, pull, allow the patient, to understand this diagnosis. And yes, this diagnosis can be quite severe and sometimes fatal. But at the same time, there can be steps that we can take before we get to, those really dire outcomes. So, that really is a great place, for me to assist healthcare providers and patients again to close those gaps and to make sure that as that information is disseminated in that first visit of a diagnosis, because it can also be just very scary and just thinking about all of the recommendations that are being given and now I have to change my lifestyle essentially.
Yes.
And that's very hard to do. So it's not going to happen in one healthcare visit. It's going to require multiple conversations. And one of the things that I often like to highlight is that many chronic diseases, it happens outside of a healthcare appointment. So we know the healthcare appointments are 20 to 30 minutes. It's not enough to really discuss a new diagnosis of diabetes. And so having those follow-up appointments, really engaging resources beyond the clinic, um, diabetes educators, so that you can continue that conversation. Because a lot of times when patients are in shock, it's literally like words bouncing off a wall. Nothing landed. Nothing, is really fully understood. And that's also where patient advocates are important to have someone else there at that appointment.
Yes.
I imagine you're going in, maybe you're having some symptoms that eventually led to the diagnosis. Some people may just be getting their physical exam and have not had one in 3 years and, really are shocked by the diagnosis. So, even in this conversation, we can talk so much about how you can really ensure that that initial diagnosis is understood by the patient and make sure you take steps to prevent really bad outcomes that can happen. And then the second point is that there is a lot of stigma around diabetes. A lot of people don't want others to know that they're taking medication, that they have to take insulin depending on where your numbers are. So A1C is just kind of allowing us to understand how well your blood sugar has been managed over the last, few months. And so that can be a big stigma. Again, you're having to change your life and you now have to incorporate this new thing into your life. And so I don't want anyone to know. Um, and then there's some things that diabetes can cause as far as, symptoms that can also be quite embarrassing. Erectile dysfunction in men, that can be a very embarrassing thing. Skin changes can be very embarrassing. Um, if you're constantly having to go to the bathroom and you can't fully enjoy dinner with your friends, but all of that to say, you're very right in the point that it takes a team, it takes a village, it takes healthcare providers, it takes patient advocates, it takes diabetes educators, it takes people like yourself who are informing, people like myself who are assisting patients and caregivers and healthcare providers along this journey because it is a very long one.
Absolutely. Yes. And the one of the purposes of this our Facebook group is to let people know that they are not alone. There are
Mm-hmm.
people who, in one way or another, ready to help.
Yeah.
Maybe this is your fellow people who were diagnosed and they are sharing their experiences. Maybe there are some caregivers who are helping with preparing the food and selecting the good, nutritious ingredients, or somebody who can help with the physical activities to
Yeah.
organize, motivate people to do something
Mm-hmm.
physical.
Mm-hmm.
Maybe there are some doctors. This is something that actually another question I wanted to ask you.
Mm-hmm.
Um, Very often, we know that people go to the doctor. This is their
Yeah.
primary care physician. They go to the doctor, and doctor gives them the prescription based on the blood work, and this is about it.
Mm-hmm.
This doctor may say something like eat better and exercise more, but
Yeah.
this is about it. Um,
Mm-hmm.
what other experts people need to talk, talking about the team, so
Mm-hmm.
what other experts, healthcare providers, you recommend people to include into their team, like the primary care,
Mm-hmm.
yes, maybe nurse practitioner in the office that
Mm-hmm.
you could have better, easier access to. Who
Mm-hmm.
else from the medical side could be in a team?
Yeah. So, and this is where it gets complex again, to that your lifestyle is changing, and then it's recommended that you do have a lot of experts and specialists involved in your care plan to try to maximize um, your progress, your improvement. So beyond the healthcare provider, and I spoke earlier about, diabetes educators. I think those are also, really important. Sometimes social workers are really important for people who are uninsured and need some resources, some support. Dietitians are huge. I think there's a big component of a lot. Food is tied to culture. And so when people hear that they can't eat a lot of the same foods that they once ate, or they can't eat as much, it can really, take a toll on their mental health. And so dietitians are really an important piece because they can help you not necessarily eliminate all of those things from your diet, but try to figure out some better ways to incorporate a lot of your favorite things into the meal. And we know by the stages of change model, it's really hard. And so it may take a lot of time, a lot of trial and error for, a patient to start incorporating those new changes into their diet. Patient advocates are huge. So again, as I'm operating as a patient advocate, so someone that is there to help you fully understand, okay, so you talk to your healthcare provider about these labs. Let me tell you what this means in layman's term. We're not talking about, medical terms, so that you can understand when, and also like working out, like what is happening when you work out, what happens with your insulin and how is that helping your body? how um how are your medications helping, that whole process of trying to produce more insulin to take all of that, the blood sugar, the glucose out of your bloodstream. So again, it's a very loaded team that's necessary. So sometimes you may need a trainer, like I said, the dietitian, patient advocate, healthcare provider, social workers. So it's a number of people that you really need on your team, and just slowly but surely try to fold them in, because it is a lot to have so many different appointments and making sure that everyone is on top of it.
Yes. Well, we are also, I've heard multiple times. Uh,
Mhm.
I have a friend, personal friend, she's ophthalmologist,
Mhm.
and she told me how often she was the one who suggested that
Yeah.
maybe your blurred vision is not the result of you aging or
For sure.
anything bad to your eyes, but
Yeah.
rather it's a result of your high uncontrolled blood sugar. So
Mhm.
from the medical standpoint, we're talking also about the eye doctors, right?
Yes. Mhm.
Um, how so I'm just looking from what my husband had to go through, who
Mhm.
he had to meet with. We were meeting with cardiologists.
Yes.
Uh, my husband had complications with
Mhm.
kidneys. He had kidney failure, so we had to see the nephrologist, the kidney doctor.
Yes.
Um, I also hear very often, and we have been introduced and spoke with several podiatrists, people,
Mhm.
doctors that are taking care of the foot health,
Yes.
because if neuropathy happens,
Mhm.
then people cannot feel the any damage what is
Yes.
maybe
The pins
happening
and
to
needle
their feet.
sensation in the feet.
Yeah,
Yeah.
yeah.
Mhm. Yep.
Okay, since we're talking about neuropathy, I have another question.
Yeah.
Is there any doctor, like neurologist or somebody who can be helpful, or these doctors in diabetes care is not that often involved? Do you know?
Yeah, so as far as specialists that deal with neuropathy that patients who have diabetes can sometimes develop depending on how uncontrolled the diabetes is. So it can be addressed from a primary care perspective.
Hmm.
You know, for those who are listening and may not know, so elevated blood glucose levels can impact any nerves in your body.
Yeah.
And so, to your point about seeing the eye specialist, that's where the eye specialist comes into, because vessels in your eyes can be damaged. So, the same way vessels in your hands, your feet. And so, some people have that numbness or that pins and needle sensation in the bottom of the feet. And it's often recommended that you're not walking around barefoot because you
Uh-huh.
can't feel.
Yeah.
And then when you can't feel, you end up getting these sores that then are very hard and slow healing. So that can, really just be a domino effect into a really serious, sometimes blood infection that could lead to death. So neuropathy can be managed from a primary care perspective. Now, if we try medication, so a lot of medications, we may try gabapentin or Lyrica to just help with your nerves. Now, sometimes the nerve damage is not reversible, but
Hmm.
we can sometimes minimize how much it hurts. And, if it is beyond, our ability to help as far as like the pain, sometimes we do have to refer to either neurology or pain management.
Okay. Oh,
Yeah.
yeah, pain management. This is something
Hmm.
that it's a different specialty. I, I just forgot to mention that
Yes.
uh, endocrinologist, the next
Oh,
person,
yeah.
the next doctor after the primary care,
Hmm.
I always would say find endocrinologists that you comfortable with and
Yes.
make visits with them, the regular
Hmm.
visits, right?
Yes. Yes, endocrinology is, very important. So, you may sometimes take over some of those cases of really uncontrolled diabetics. For the most part, many patients can be followed in their primary care setting.
Mhm.
And the one thing that I will say, as we are talking about so many specialists, is do research on specialists, look at their bio, look to see what they specialize in, look at their reviews and their ratings. For those who may not be limited by insurance and what specific provider you can see to make sure that it's going to be a good fit for you. Just like you shop around for clothes, I think it's also really good to shop
Oh,
around
this is,
for
yeah,
your healthcare provider because there's someone, again, diabetes is a really heavy diagnosis. And so you want to make sure that everyone on your care team is invested in you and you feel comfortable because that will help to also optimize your outcomes.
definitely. One more expert I thought of that
Yeah.
we didn't mention yet, and these are, I think, and the doctor who is helping and paying attention to um,
Gastroenterology.
gastroenterologist.
Mm-hmm.
Yes, because so often diabetes as a partner diagnosis comes this gastroparesis,
Oh, for
which
sure.
is very hard to handle, to
Yeah.
manage, and
Yeah.
the doctor who can monitor it for you, I think, could be helpful.
Yeah, there is a connection pretty much to all specialists. I don't know if we meant to mention dentists,
Oh,
as
no, we
well,
didn't.
because
Yes,
yeah,
dentist,
I
of
mean,
course.
there really is no specialist that you probably could not make a connection with patients who have diabetes because you think about dentists and oral infections, it's really important to make sure your gum health is optimal in your teeth, because if you get an infection in your mouth, it's a very easy way into your bloodstream. And then you
Yes,
have sepsis, and then that, again, really, really bad outcome. Um, so, yes, gastroenterology and dealing with gastroparesis. And that just lets you know, as we are, really making all of these connections, just how multidisciplinary you have to be when you're thinking about diabetes because it's really all hands on deck because there's no body part or organ that's left untouched by diabetes because your glucose levels are elevated and it's affecting your bloodstream, your vessels, and so that's pretty much your entire body. So really just trying to maximize all the specialists that are necessary. And that's why I think primary care is really, really important because we manage a lot we often don't send to specialists until, things are really bad or really out of control where we need some expert opinion.
definitely. One more important person that we didn't mention, the
Yeah.
pharmacist.
Oh, yes, yes.
This
Pharmacies,
is
absolutely. Yeah.
somebody so often overlooked. People go to
Hmm.
pick up their prescription and
Hmm.
they just like, do you have any questions? No questions left. But
Yeah.
the pharmacist actually can also help with understanding of certain processes and what to
Hmm.
expect from this specific medication or
Yeah.
combination of medications or time of day when you take this medication. This
Yeah.
is something that doctor the primary care often doesn't have time to go over, and the pharmacist could be very helpful in that respect, right?
Yeah, pharmacy, I'm glad you raised that a point because medications, when you start them for diabetes, they are not without side effects. And pharmacists are really helpful in just making sure that you are aware of the possibility for side effects. Because let's be honest, if a patient is prescribed a medication and their stomach is upset, they're throwing up on it, they're not going to be likely to continue that medication because the side
Hmm.
effects are just too great for them. And that is, even impacting their quality of life. So I certainly support, pharmacists. And sometimes if people are diagnosed in the hospital, they may go in because they're having really bad abdominal pain and they get to the hospital and they realize they're in diabetic ketoacidosis. Blood sugar levels are really off the charts. And really close to coma level. And so pharmacists can do a really good job in the hospital and making sure that, patients leave and are discharged on a good plan. But again, once you get home and you're taking that medicine, how does it make you feel? How likely are you going to continue that medication if it's just not, agreeing with you? And sometimes it does take a little bit of time before your body adjusts and it eventually gets better, but it can be rough in the beginning.
Absolutely.
Yeah.
Well, wow. Listen, after all this, listings, I have one question for you. You
Right.
mentioned several times patient advocate.
Mhm.
Who do you mean by that? Who is there a special person somewhere, or you talking about the family member, or the friend or someone? Who you talking about?
Yeah, so patient advocates can come from different directions. So some health systems have patient advocates, and their role may be kind of limited based on what the healthcare organization has designed for them and their job description. But for sure, family members, friends can be an advocate for you, for someone who knows you and essentially is able to speak up for you. Um, and you also have people who are trained, who are certified. So myself, I'm a clinician, so I can understand health information. I can understand the lingo. So I can be a conduit between the healthcare provider and the patient and just
Mm.
making sure that the patient's needs are addressed. Because as healthcare providers, a lot of times we are very busy. We're moving from room to room, patient to patient, and sometimes it's hard to reset. And sometimes it's necessary that we reset to make sure that we're able to see the patient in front of us. Um, kind of a clean slate, a new encounter, and making sure that we are addressing their lived experience. And so that's where a patient advocate comes into play to kind of help that healthcare provider reset and say, let's pump the brakes a little bit here. This recommendation may not work for this patient, and this is why it may not work for this patient. Is there another avenue we can take? What other options do we have? So we know diabetes management is not a one size fits all. What works for one person may not work for someone else. So an advocate steps in and where someone may feel intimidated or uncomfortable to speak up about what it is that you're feeling or what it is that you need, that advocate can step in for you and help to bridge the gap between the provider and the patient.
But where you meet those patient advocates, where do they work? They're like in doctor's office, or it's
Mm-hmm.
insurance position, or it's where do we meet? Because it's a wonderful description that you're
For
giving me,
sure. Yeah.
but not that many people had an
Mm-hmm.
experience of having such a person, meeting with
Yeah.
such a person, where they are.
Yeah, so I think that's one of the downsides is that a lot of patient advocates are not covered by insurance. So as we were kind of highlighting a lot of the specialists that, most insurance will cover, patient advocates are typically an out-of-pocket cost. And so as far as marketing and how you find out about patient advocates, it can be word of mouth, it can be websites, it can be podcasts. Um, so it really just is just networking is one way, but there are some health centers who do have patient advocates that can support, again, maybe limited and not necessarily getting into the nuts and bolts of the conversation that you're having with your healthcare provider, but, you know, kind of bridging the gap between your primary care and a specialist and saying like, oh, well, you can reach out to this person. I haven't been able to contact this specialist. Can you help me out? So kind of more of the you know, things that are helpful, but more of the external type things that may be necessary. So just kind of plugging you into other resources, but may not necessarily be able to help you on the day-to-day basis. So Facebook is a good avenue. Instagram is a good avenue. Again, podcasts, but really just, talking with your network, searching, Googling. We all like to Google, right? And so I'm
Yeah.
sure you can find, people that may be able to support you. But again, I think one of the biggest barriers is for the majority, it is out of pocket cost to cover
Okay.
patient advocates.
It sounds like just thought that when we have legal issues, we're saying I'll call my lawyer. So
Yeah,
when you have health issues, I am not familiar with all these terms. Let me call to my how do you
yeah,
call the
patient
patient
advocate
advocate.
for sure.
So this is a special uh, person for hire
Mhm,
that they probably have their own businesses
mhm.
and
Yes.
they are representing the specific people who either not educated or have no time to search
Mhm,
information, right? um,
mhm.
or not
Yeah.
brave enough to speak for themselves, so they need someone to come with them
Mhm,
and represent them.
mhm.
Wow,
Yeah, I never thought about it
interesting.
in that term of a lawyer representing clients as, as far as a patient advocate. Yeah, but that's, my work. I can attend patient appointments and I can also help them outside of their appointments. So,
Yeah.
it varies in kind of the scope of different patient advocates.
Yeah,
Hmm.
absolutely. Well, Terry, this is amazing, and we're already out of our time limit. So let's do real quick. Please tell us where people can connect with you if they want to hear more about what you are doing, or
Yeah.
if they have questions for you, how to reach out to you.
Yeah, I'll be happy to connect if anyone has any follow-up questions. So my website, which is currently being worked on, but once it's up, it is Evolve Health and Wellness Community.com, and it's long. So once you find it, bookmark it. I'm also on LinkedIn, Evolve Health and Wellness Community. I also have a personal profile, so Terri Y. McGuire. And I have an Instagram page, Evolve Health underscore Wellness Community, and I also have a YouTube page, Evolve Health and Wellness Community. So pretty much across all platforms, I'm Evolve Health and Wellness Community, and I look forward to meeting you all or continuing the conversation.
Perfect. Well, thank you very much, Terry, for your time. Before we say bye, let me just remind everyone about few things that I don't know, new people who just discovered us, didn't know about our Facebook group, Diabetes
Mm-hmm.
101 for Beginners. I wanted to let everybody know that in our community, in that Facebook group, we have bi-weekly support group meetings. Here they are that happens on Wednesdays, every other Wednesday at 7 p.m. Eastern Time. On Thursdays, of course, we have this podcast that you are watching right now. It's going live at 4 p.m. Eastern Time, but of course, it's staying in featured posts, and you could see the replay there and make comments. And we are trying to respond to all the questions and comments. One more thing that I wanted to let everybody know that we do have the YouTube channel. It's called Smart Move 360, and the podcast you are listening to is called Diabetically Speaking with Smart Move 360. So you could watch it there and see. This is our third season, so you could definitely go there and see our interviews, listen to our guests, because people of very different levels, not levels, different areas of expertise are there. One last thing I wanted to remind that every month in this year of 2025, our registered dietitian Kim Kyle and myself, we are running a crash course for caregivers. Of course, every single person is a caregiver for themselves, so everyone is invited. These are go the core. These are presentations when we talk about different aspects of diabetes in detail. So we spoke about the insulin resistance, we spoke about the H1C, we spoke about the healthy fats and snacks, and the label readings. So a lot of different details we're discussing there. Everybody is invited to go and enjoy our YouTube channel where all these episodes are posted. With that, Terri, one more time, thank you very much for your help. Thank you very much for your time. And I hope we will be continuing working together and providing information to people that is needed.
Thanks for having me. It was a pleasure. It clearly meant we were having a really good conversation because 30 minutes went by really quickly.
Yes, absolutely. All right. Bye bye, everybody. See you next week.